We identified with the help of Allocation Assist also that Dubai has got excellent infrastructure.
Yeah.
They're very open to new ideas. We are sitting at a time when there is war going on and still we feel safe and we're able to have a conversation at peace.
Hi, Dr. Mohan. How are you?
I'm very good. Thank you very much.
Thank you very much for attending Allocation Assist podcast. Can we start by introducing yourself, your background, and where are you working right now?
I am Dr. Arunodaya Mohan. I'm a consultant hematologist. I currently work at NMC Royal Dubai Investment Park and also work at NMC Specialty Hospital at Al Nada. I've recently moved from UK where I worked at the NHS, where I was trained for several years in hematology and with some background pediatric experience too, and have worked as a consultant in several district general hospitals and tertiary centres in and around London and in the Kent area as well.
Dr. Mohan, you trained from the most respected hospitals like Hammersmith Hospital, Great Ormond Street, John Radcliffe Hospital as well. So with over 20 years of experience, what inspired you to move to Dubai?
My years of training and experience is in NHS has made me a clinician as I am now. As you know, NHS is an extraordinary system. It's very organized with dedicated colleagues, nurses, excellent teamwork, collaborative approach, audit and research. The desire to move or the decision to move was mostly for growth and build on the experience that I've already had into a different healthcare system, which is also rapidly evolving as in Dubai. We identified with the help of Allocation Assist also that Dubai has got excellent infrastructure. They're very open to new ideas. They're happy to invest in new treatments. And so with the capabilities they already have and with the infrastructure and the organization that is being provided in healthcare in Dubai, I thought that this is the right time, also that I was ready to move and explore new challenges. And with the patient population here as well, have good experience in working in and around London, where I deal with patients with multiple ethnic backgrounds. So there are specific hematological conditions which are predominant in certain ethnic groups with a diverse population. So that experience would probably give me an advantage to work in a similar kind of diverse population group as we find in Dubai, and I wanted to explore my opportunities and grow.
So be honest with me, Dr. Mohan, what's your biggest fear when relocating to this region, and what is the reality look like?
I would say, just like any other family would be moving to a new country and to a new job with a different healthcare system. Obviously, you would have fears of, whether you would be adapting to a new healthcare system, to a new set of patients and how the system works. And obviously, within the family, whether, your kids and everybody would find a similar environment in schools and things like that. But I should say our fears were not all addressed well in Dubai. We were quite welcomed, both at work and also for living as well. At work, where I work now, we have got, as I said, enough or supportive environment, both from the infrastructure, from the services that are offered, and from colleague support. I feel that I am in a very safe, supported place at work and has got enough potential to be able to work in a similar way that I had worked before. And similarly, with the family needs, they're all very well met here. We got enough support for childcare and home help and schools, which provide similar kind of education that we had been used to elsewhere as well. So I feel we did not miss anything, and it is a very enriching atmosphere that I'm currently exposed to and well adapted at this time within a very short period.
Perfect. So, Dr. Mohan, what does Dubai offer professionally and as infrastructure as well that surprised you?
Professionally, Dubai's healthcare system is rapidly evolving. It is looking forward to new treatments, advances. They are very ambitious, organized, and moving fast pretty quickly. The treatments that we are able to offer in many specialties and super specialties are available, provided we ask for them. And some of the chemotherapy medications that we're able to give is able to be provided to the patients much earlier with FDA approval and the local regulatory system compared to other places in the world where we would have to wait for funding approvals. That gives an advantage. We have a similar kind of collaborative approach with other specialties, which is really needed in this kind of specialty like hematology, where these patients are needing high-risk treatments and they need multidisciplinary team approach from many other specialties. So I feel that we're able to provide safe, efficient, excellent quality of care, even for very highly specialized treatments like needed for hematology.
Okay.
From the personal point of view, Dubai, as I said, has got excellent home help, and personal needs are met with very quickly with regard to childcare or people to help us at home. And I would say quality of life is far better. We have places to see around.
Everything is easy, right?
It is easy. So now we are sitting at a time when there is war going on, and still we feel safe and we're able to have a conversation at peace. So I feel very lucky and grateful to have been here.
So, Dr. Mohan, you were working in NMC Royal, DIP, as a consultant hematologist, and you're coming from NHS. So how the environment, the setup, the infrastructure look like in your hospital now?
So NMC Royal DIP and NMC Alnada Hospital, they have allowed me to work at a level that I have been working before as well. And they have got excellent infrastructure in all subspecialties, that there is very good potential to be able to provide advanced treatment for hematology patients. They also have a collaborative approach across different specialties, multidisciplinary team approach, and we have good access to chemotherapy medications, which is a very crucial need for these kind of patients. Our lab infrastructure is excellent. We are able to provide specialized diagnostics, whether it be molecular or genetic studies or genomics, in bone marrow samples and CSF samples, because the diagnostic part of laboratory diagnostics for these kind of patients they are super specialized. But our lab has got excellent referral pathways, or whether it be outsourcing. They're all well set up to be able to provide this kind of care, to be able to timely diagnose and treat them efficiently. We also have hematology MDT, where we discuss hematological patients with the clinicians from other NMC hospitals as a network, which provides us the opportunities to discuss this from many clinicians who are able to treat or who are treating hematology patients. And that gives also an advantage, because these colleagues are trained and have good experience in many other countries in the globe. And we are able to use all of that experience to be able to best manage our patients in the most efficient way and choose the most safest and efficient advanced treatments for each one of our patients. And we have excellent colleagues support, higher management, and nursing staff who are very well experienced. So I would say I'm lucky to be part of this group who are being able to support our services very well.
Amazing. So let's talk about the practical part as well. From getting the DHA license and getting the perfect fit at the NMC Royal Hospital, what was your experience using Allocation Assist services?
I should say I feel very lucky to have found Allocation Assist. Yes, as you can imagine, finding a job, to do the search and to the research behind it can be quite demand for someone who already has a demanding job to do on a daily basis. So whether it be licensing or finding the right place at the right time, and meeting expectations with regard to certifications, and also aligning my interests and professional goals to a place who are able to provide that is I think has been very helpful and supportive. And they have been very honest, and I think I made it here much earlier than what was expected at that
time
time.
frame,
So
yeah.
I feel very happy and lucky to have associated with Allocation Assist, and I would want to continue to work with them in the future as well.
And to work with you as well, Dr. Mohan. Okay, so Dr. Mohan, can you tell me about the type of patient that you see, and also where can we connect with you, or where they can connect with you?
Absolutely.
Yeah.
Thank you very much. So I deal with, or I'm a consultant hematologist who can deal with hematological conditions, whether it be what we call benign or non-cancerous conditions, like abnormal blood counts, like we say anemia, low platelet counts, bleeding, and clotting problems, and what we call is hemoglobinopathies, like sickle cell thalassemia patients. So those patients we would be able to see as well, or suspected cancers, whether it be myeloma or lymphoma, chronic leukemias. Anybody would be able to come and see me either at NMC Royal Hospital or Al Nada Hospital.
Okay.
As a general approach, what I would say is if you have had some unexplained weight loss or fevers, continuous fevers without reason, you are experiencing some lumps and bumps, some lymph nodes elsewhere, or having sweats, unusual bleeding and bruising. So these are the symptoms that you would look for, and if you think you have this, you can approach directly either your internal medicine doctor to start with a blood count, and then they can be referred, or directly come and see me as well.
Okay, perfect.
I should say, so far, although we've been a new department at NMC, we have treated quite a significant number of patients. We have started treatment for high-grade lymphomas, and even including refractory patients, like we had a patient with refractory TTP who are all difficult to manage, refractory HLH patients who some of them are doing very well currently on treatment, refractory ITP patients and pregnant patients, and several critically ill patients, although we are a new department, have been able to initiate and sustain treatment too. We are currently have introduced several treatments, including venesections, iron infusions, blood transfusions. On top of that, some bispecific treatment, which has been globally initiated only in the last 2 to 3 years' time. We have initiated that kind of treatment, and we also have robust referral pathways for bone marrow transplantations too. So please do reach us out if you have any suspicion of hematological conditions. We would be able to direct you on the right pathway.
Perfect, amazing. There is a perception issue, Dr. Mohan, here in the region, that especially for female doctors who are trained from the West, there is some hesitation relocation to this region. So how was your experience with that?
I'm also one of those who may have heard these statements. I think after being in the country, I think they are mostly assumptions than real. I feel quite overwhelmed with the respect and the value that they give for women in here, including healthcare system and outside. So I feel I am heard. My opinions are very valued here. They really seek advice from you as much as they would do from any other clinicians, regardless of the gender. And in fact, sometimes feel more respected. So I think these are assumptions, and you would come to know the reality once you reach. And within our hospital and elsewhere, there are many women in leadership positions. They are head of departments. They are chairing, multidisciplinary team meetings. So I see women all around here in higher positions, and quite happy with what they have done so far and are doing and growing very well in their respective fields. So I do not find any reason to have this in your mind, and I would encourage them to come here who would be actually having excellent opportunities in their own respective fields.
Okay, perfect. Thank you very much, Dr. Mohan, for your time. Lovely speaking to you.
Thank you very much for inviting me.
Thank you.
If you're a Western-trained doctor ready for more, message Allocation Assist Middle East today for a full consultation on salaries, contracts, and medical license in the UAE, Saudi Arabia, or Qatar.